Assalamualaikum. Today I'm going to talk about Clinical Skill Training Centers or CSTCs and how they can be improved. These centers play a crucial role in medical education by helping students like us gain practical skills before we start working with real patients. In this presentation, we will explore how collecting feedback from students and faculty has led to meaningful improvement in CSTC, making them more effective and supportive learning environment. A clinical skill training center is a special learning space designed for medical students to practice hands-on clinical skills in a safe, low-risk environment. Here, we are learn essential procedures such as CPR, measuring vital signs, performing physical exam, and more. These centers provide a realistic setting where students can build confidence and competence before stepping into real hospital or clinics. Practicing in CSTCs helps ensure that we are better prepared to care for real patients. Despite their importance, CSTCs face several common challenges that affect the quality of training. First, there often isn't a proper system for collecting feedback from students and faculty, which make it hard to know what needs improvement. Also, soft skills like communication, empathy, and teamwork aren't always part of the training or assessment. Some centers suffer from old or broken equipment, and training sessions may be irregular or poorly organized. As a result, many students feel anxious or unprepared when it's time to enter real clinical environment. To address these issues, researchers developed a new feedback tools, essentially a smart and structured survey designed to evaluate different aspects of the training experience. This tool focuses on 5 main areas: the overall quality of learning, the availability and condition of equipment, the effectiveness of the teaching, how realistic the environment feels, and whether students believe the training is useful for real clinical situations. The goal was to create a reliable system to collect honest, constructive feedback that could guide improvement. The researchers didn't just collect feedback from one group. They included voice from all levels of the medical education journey. This included preclinical students who are just beginning their hands-on training, externship students who are gaining real-world exposure, internship students who are preparing to become doctors, and faculty members who teach and supervise these activities. Getting input from this group ensures a well-rounded understanding of the CSTC experience from both learners and educators. The feedback tool showed a reliability score of over 83%, which is very good. This means the tool consistently produces accurate and trustworthy data. In other words, when educators use this tool, they can be confident that the information they are getting truly reflects the strengths and weaknesses of their training centers. High reliability is important in research because it shows that the tool works well and can be used for long-term improvement. Thanks to the insight gained from the feedback tool, several positive changes were made in the CSTCs. Teaching methods were improved to be more engaging and effective. Outdated or broken equipment was replaced, and the simulation environment were updated to feel more like real hospitals or clinics. Most importantly, students reported feeling more confident and less stressed about entering clinical practice. This improvement showed that listening to feedback really can make a difference. Improving CSTCs matters because they play such a key role in preparing students for real clinical work. They allow us to develop both technical and soft skills in a safe, controlled environment before dealing with real patients. By using structured feedback system, schools can make these centers even more effective. That means better learning, greater confidence, and ultimately safer and more skilled future healthcare providers. To wrap up, CSTCs are incredibly valuable tools in medical education, but like any learning environment, they need regular feedback to continue improving. This feedback tool gives students and faculty a voice, helping identify what's working and what isn't. By working together, we can create stronger, more supportive training centers that truly prepare us for the challenges of real clinical practice. That's all from me. I hope you enjoy this video. Thank you and Assalamualaikum.